Hello, my name is Deb, and I'll be demonstrating the Foley catheter insertion, and you would need a physician's order for this. And there are several kinds of catheters that are placed. One would be a indwelling catheter, and that's what we'll be showing you today. And to show you what it looks like just before we take it out of the box, this is a non-sterile one, of course, that we're just going to show. It's all connected. You've got your Foley bag, and at the urine collects in, a little spot where you can drain it. It goes all the way to the tubing up into the insertion part, and just to let you see that. This catheter is held in place with a balloon that is filled with sterile water. Okay, so that's that. There is also a straight catheter. Those are the kind that we give people when they are unable to void and they just need a little bit of help. Their bladder is full, and we can drain it that way. After we got our doctor's order, we want to know what size of catheter to use. Doctors generally won't always order the size. They'll just say place a indwelling catheter. Women, usually the size they have is 14 to 16 French, and a male adult is a 16 to 18 French size catheter. We want to check for the indications of the catheter. Several of them are during childbirth. Sometimes to give a little more room for the baby to come down, we will get the urine out of the bladder. During a surgery, usually a big abdominal surgery, they'll want to decompress the bladder, and a Foley catheter will be put in then. Sometimes for incontinence purposes, infections, different things like that. We'll assemble our equipment. First off, we'll have things for our peri-care gloves and some washcloths and towels. I will have my catheter kit, and I will look at it carefully, make sure I have the right size, what size the bulb is. Also an expiration date, and this is a complete Foley Kit indwelling. It has everything I just showed you before. There are sterile gloves in here, but I will also take an extra set of sterile gloves in case these don't fit right or I contaminate or something. So I have an extra set of gloves. I also have a blanket for draping my client. Okay, we're going to also think about our client's mobility. This is a 90-year-old woman. It's going to be kind of difficult for her to be in this position for a long period of time, so I'm going to ask for an assistant. Bonnie's going to help me here as far as my extra person. If I need extra lighting, she could have a flashlight. An elderly person or someone that may be confused, we're going to want to make sure that we have some extra help in case they would touch the sterile field. So you have to look at that before you think any further. So I've got that ready to go. I'm going to walk into the room, introduce myself. Hello, Mrs. Smith. I'm checking her ID band. My name is Deb, and I'll be your nurse today. And Dr. George has ordered a Foley catheter, so we're going to be putting that into you today, if that's okay. It's really not a painful procedure, but it can be a little bit of pressure. So she agrees. We're going to get things ready. What I'm going to do first is want to check for allergies to betadine, because we'll be using betadine to clean the peri area. Latex, of course, the catheter is latex. My gloves could be latex, and tape. So we'll need to do that. What we're going to do is we're first going to do the diamond drape, and Bonnie's going to help me with that. And we're first going to take down just the top, the bedspread. We'll bring that down. And we've got our top sheet here. We want to really keep the patient nice and maintain privacy, so I close the curtains. I've made sure that the door is shut, and we're ready to go to work here. So we're going to get our diamond drape going. And I will at this point also, for body mechanic-wise, I want to get the head of the whole bed up. I kept the rails up at this point, but I'm going to place the bed in the upright position where it's comfortable for me. Okay, then at this point, and I'm working down this way, so I feel for more safety, I would probably leave these rails up at this time. Okay, we're going to take the top sheet and pull that down, keeping privacy maintained by leaving this blanket on. So that'll be down and out of our way. And now the diamond drape consists of the point up at the top by her chin, the other point by the arms, and the last point down by the legs. Okay, Bonnie's going to help me. We're going to bend the knees on our client here. I'll be in the back line position here. Wrap, for a little more warmth, we kind of try to wrap these corners around this. And I am going to be talking over a sterile field. We generally don't, but just to explain this procedure to you, I'm going to be talking. I'm going to open up the area here so we can see. So that's ready to go. This would be when I would do my peri-care. You don't have to do it as such in the return, but you do have to state that. So everyone knows how to do peri-care. We've done that first. I've washed my hands now after the pericare, and I am ready to start. I'm going to clean off my table. I'm ready to go. I've got my kit here. And I'm going to open that. I've checked my expiration date. I emptied all of that before. And they're all going to be different, every kit that you run across. And what we can do is save the outer package for my betadine swabs that I need to throw away. That can be placed either, depending, some people like to place it here, other people here, and I think I'm just going to put it over this way for now. And this talks about everything that's inside of it. We've looked at this in the expiration date. Put that in here also. Okay. I'm looking at my container now. Everything looks intact. Nothing's wet. Clean surface. My patient is very cooperative. Bonnie's here to help me. I'm going to open up the kit down here. There's other ways to do this. I could open up the kit out here if I had worried about the patient being combative or moving around, but I'm going to do it right down here. Let's see if we get that down. Okay, we want to open the kit. We want to take the first flap, needs to go away. Unless I'm going to pull up this way. The outside is not sterile, of course. I'm going to bring my arm around. And sometimes they like to stick and come back. This one. And I'm holding the outside of the paper. If I would have a cold or something, I would want to wear a mask at this point. And again, I would not talk this much. I'm explaining it to you. Okay. And the third one, I'm holding right underneath here. I'm not touching anything inside of that package. We have a 1-inch border, as you all know, with your sterile field. First thing is the sterile gloves are on top. They're in their package yet, so I'm going to pick them up right in the center on the outside of the package. I'm going to set this right over here. Next, this is my my drape that I will be putting underneath the patient. I'm going to pick that up. Oh, it's not even bent. And you'll find everything looks a little bit different. This will be, there's no little bend in it where I can pick it up. So where I do touch it, I better just keep. That's going to be a part that's not sterile anymore, okay? So I'm going to pick it up at the corner without touching the sterile field inside of there. The back of this is always, I already touched the side, so I'm just going to open it up like this, okay? The back of this is plastic, so that'll help if anything drips. It'll help on the bed, so it wouldn't stain the bed. So I'm going to have Bonnie help, and it is kind of, I'm not going to touch at the bottom because this is sweeping over my sterile field. So I'm going to slowly down and bring it over. And underneath the patient. Okay, there we are. Now, I've got a little trouble with, I want to have a nice sterile line here. So I do need to possibly, remember we have our inch border, and I think I can pull right here and bring this down. Your body could pull there. I could go around that way too. We don't want to reach over our sterile field. We can be underneath, and there's my inch. We'll let that just rest like that. Okay. The next thing is there's another one. I can extend my sterile field. This I will pick up. If I want to, I could use this. If I choose not to, and I've already touched it, this is like the fenestrated drape, and I'll show you guys what that looks like. I'm not going to use it. That's why I'm opening up and touching it. If you needed to extend your sterile field, you could maintain sterility. I think I've touched it all over, so I can't. But if I just touched it here and here, I could possibly swoop that over and use that to extend it. I'm not going to use it at this point. Okay, so the next step is I'm going to place my sterile gloves on. Okay, I might move my table up. I want to make sure I'm watching. I also do have a helper here, which is great. We've all done sterile gloves before. Of course, I've washed my hands before I started. And I'm going to go at the next one. If I need to touch the paper on the edges, I can. And you'll get different kinds of sterile gloves in each pack. So like I said, it's not a bad idea to bring another set of sterile gloves if you need it. Okay, so here's my sterile gloves. Now my hands are sterile. Everything I touch now will be in the sterile packet, back and forth. To look at my pack here, I do have some betadine swabs. I had checked earlier if the patient was allergic to betadine, remember that. I do have lubricant. I also have a little name tag here if I was getting a urine sample. Okay, what I think I'll do first is possibly my betadine, which is nice, and they'll come different ways. These are little swabs, betadine swabs. So I'm going to open them up and just let them sit here and get the top off. Some packets have just betadine and cotton balls. So you have to open up the betadine and dip it in have the cotton balls dipped in and use a forceps. So this is a little bit handier. You want to be careful with betadine. It can squirt. So I'm just going to take that off slowly. And there's plastic lining it, so that's why it's a little hard to break apart, okay? Got my 3 betadine swabs. I'm just going to set them in my tray. I also have 2 swabs that are clean that I will wipe off if I need to. I drop that in. Notice how I drop high. I didn't want to touch that bag at all because then I would break sterility here. What I'm going to do next is I can bring this over and set it here because I'm not going to go past. Okay, I dropped my things there. I'm going to check my balloon. Pick up. This is sterile water. And we want to check the balloon to see if it's working properly. It is nicely covered, which is really nice, with a little plastic bag. Sometimes I like to leave that on until right at the end. So right now I'm just going to check my balloon to see that it works. A little black cap. Any little pieces of anything, make sure you get it away from the bed so it doesn't get stuck in the bed here. And we're going to check the water. My balloon says here 12 French, that's the size of my catheter, 5 cc's or 5 mLs of fluid. So I'm going to push, and sometimes I like to put in a little bit more. And I'm going to watch the balloon, and it gets nice and big. And then I'm going to see that it's patent, so I'm just going to let it out. And while I'm going to pull back, and I'm going to keep this syringe attached and get all my fluid out of there. Okay. Now this is kind of hanging around. I'm going to get this out of here just because it's kind of falling off, this plastic. I want to be very careful I don't touch the end. And this is going to set in here too. Okay. So that came apart again. Again, everything's sterile here, so I'm going to touch and get the air out of here first. And I'm going to reattach my syringe to where my balloon is going to go. Other thing I see in here that I do not need is container for the urine sample. At this point, I'm not collecting a urine sample, so I'm going to set that down. Watch where my hand goes. Don't touch anything. Just set it without contaminating. Okay, the next thing, that is ready to go. I'm also going to get my lubricant ready, and that's going to be right over here. In that pack. And these come in syringes sometimes, a syringe form. We'll lay it here and kind of let it spread out. We need to lubricate 1 to 2 inches on a female and 5 to 7 inches on a male. Okay. Next thing I'm going to do now, and this is where one of my hands will be committed and they will be not sterile anymore. I'm left-handed, so I'm going to put the catheter in with my left hand. So I'm going to come up here, and I'm going to take my hand here and open the labia, spread the labia. And at this point, I'm down to 1 hand, but I'm going to do my cleaning now. And we want to always make sure we clean from the front to the back. We're going to do the furthest side of the labia, minora, down, majora down, and I'm going to go around and off, away from my sterile field. Second swipe will be on the closest side to me. Down, up from the top and down. And again, I'm not touching my glove at all with this. I'm coming out and around. The third one, we'll go straight down the middle. Straight down. Out and around. I'm keeping my hand, the hand that I used already, I'm keeping that pulled apart, because once we would let go of that, all that tissue would come back together, and then we'd have to do it all over again. So I'm keeping that nice and tight. If I needed to, I would take another sterile one and clean off the area to see. Okay. Next, Let me just move this out of the way just because I think it's going to be in my way. And I will get my catheter ready here. I'm going to bring it up here out of the container. And this is a time when someone could grab that in if they wanted to. You don't have to, but that way it can kind of be back a little more yet. And I'm going to go ahead, and my thing fell off. So, and I'm one-handed, so I got to think about this. What I'm going to do here, I still, of course, which hand I cannot use. That one's there, and it's got to stay because it's holding the tissue apart so I can get the catheter in. And I'm going to do this with one hand. This always kind of happens sometimes, so okay, I'm going to make sure it's not nice and tight, hopefully. So I'm going to go over, this box is still sterile, I'm going to come on over through, and I'm going to sit right here, and I'm going to put 1 to 2 inches lubricant on my catheter. I got quite a bit here, and I'm going to get it stable, so I'm going to go up a little bit. Try not to get any lubricant on your fingers when they slide. I'm going to have my client bear down, and I'm going to say take just a nice bear down. I'm going to go in slowly, and I'm slowly backing up. My fingers here are not touching the labia at all. I got 1 to 2 inches. I see some urine. I go another few more inches, and then I've got the urine flowing. I'm going to hold my catheter now right here, and I'm going to put my fluid in, because if I didn't do this right now, the thing would come right out. The catheter would come right out. So I'm going to put my fluid in. Oh, it did work fine. I've got some in. I'm tugging now. It just came apart, but I got my 5 mLs in. As I tug, it's holding fine. It's doing really, really well. So urine is flowing right now. I'm thinking, okay, I need to get that down, but where have my hands been? Think about it. They've been putting the catheter in. I right away am going to change gloves immediately. And I've got some gloves right here. These would go in the, and that's the catheter. And we're checking the urine here for color, consistency, and amount. I would also do pericare soon here because that betadine can be irritating to their skin. So I'm going to pull this out, away. This will be put away, and we're going to bring this along here. We have tape was our other supply that we did need. I'm watching the urine flow, and there are different ways to do this. There are leg bands that people wear also. We want it on the inner upper part of the thigh. I'm going to bring it down here. And depending on hospital policy, some places say it's okay to be under the leg, other places say over. I like it where it's not kinked. It always needs to be below the level of the bladder. I'm going to hang it here on the bed. It will not hang on any side rails at all. Just on the bed frame. I'm going to do pericare, wash my hands, put on clean gloves, pericare, wipe front to back, take my gloves off if I need to wear gloves again, which I will be. I'm going to handle this some more. I'm going to check that it's flowing good, help my patient get comfortable. And again, with the urine amount, we have to really watch this, because if a patient would lose a lot of fluid really quickly, like depending on hospital policy, but usually 500 to 750 mLs, really quickly we need to clamp that catheter 15, 20 minutes, because they may be going to some type of hypovolemic shock from too much fluid loss too soon. Another thing, if you have a patient that is unable to void, you can always check the suprapubic area and palpate that and see if there's any pressure-y feeling. It's firm, they're complaining of pain. That's a sign, too, that they're not emptying their bladder sufficiently. They need a catheter in, or at least an in-and-out catheter. And I would put all my materials away. Things that I used on the patient as far, and I would have gloves on. I use the betadine swabs right at the perineal area. I would be putting them in a red hazard bag. Some of these other things I would not need to. And then I would chart, of course, but first I'll get my patient settled. I'll put this stuff away. And I would make sure my patient's comfortable. She's already had her pericare. I'm going to put the bed down. We're going to put this back up. For privacy again, we're going to get rid of that blanket. And make sure that her legs are straight and she's comfortable. The catheter is working well. There's no kinks. It's flowing right down, nicely down. I would check her alignment in bed to see that she's doing okay. We have kind of a, make sure her legs are nice and straight here. Mrs. Smith, is there anything else that she would need? Did that seem to go okay for you? How did she tolerate it? That's something we want to talk about too. You comfortable lying flat? Would you like your head up a little bit? And I'll put the head down all the way. So my side rails are up, the head is, side rails up, the bed is down. She wants to stay resting at this point. As far as my charting would go, I would wash my hands before I left the room, and then I would chart basically what size catheter, the size of the bulb, how much water I put in that, what size French, 12, 14, 16, whatever. How did the patient tolerate it? How much urine was out, clarity, color, consistency, those types of things. And that would be about it, I think. Thank you.